everybody. This is Aminah and Dr. Singh. We're at Aborn Clinic, and he's been generous enough with and introduce Jack.
That's our Jack, our office kitty, the resident cat.
And how old is Jack?
Jack is 16 now.
Hey, that's why he looks so fabulous. So fabulous. So Dr. Singh, thank you so much for letting me come and kind of ask you a few questions. What would you say is the number one reason to come to a vet?
The number one reason people come to us is when their pet is not feeling well, when they are sick and they're not their usual selves. You know, as you can tell, a pet parent can tell right away, my dog or cat is not acting right, and that's when they will come to us.
Absolutely. What do you feel, if you had one thing, hopefully we'll get to 3.
Yeah.
But we have a lot of patients coming and going, and that's our priorities, make sure they are cared for. But what is the one thing you would hope people would do that maybe they're not doing enough? Is it vaccinating? Is it spay and neutering? Is it adopting stray? What would it be?
I will say the preventative care, so like vaccines, deworming, feed them right, exercise them well, you know, that's the number one thing you have to do, you know. Just like you take care of your body, just like that, you have to take care of your dogs and cats too.
Absolutely. What would you say is your number one difficulty with pet parents? If you had to narrow it down to one.
Narrow down to one.
Just to one.
Let's see, what's the number one thing? Well, sometimes they baby them too much, you know.
Do you see a lot of clothes coming in on animals?
Yeah, exactly.
I
like
see a
Halloween costumes.
I see a lot of clothes.
A lot of clothes, Halloween costumes, you know. So people baby them too much and understand that. But sometimes they baby them so much, they get in trouble, okay? So baby them is okay.
So what's the top 3 troubles you see with overloved pets?
Feeding them chocolate cookies.
Oh, chocolate is poisonous.
Yeah, feeding them maybe grapes sometimes.
Now, why do you say grape? The choking issue is
choking
human
issue is like,
with children also, but why do you say that specifically
so
for pets?
grapes can be toxic to dogs in terms of like they can cause kidney failure in dogs.
Wow.
So we gotta be very careful what we feed to them, you know. So make sure that whatever you feed them is pet friendly and it won't hurt them. So grapes are a big no-no.
Dogs specifically, because I haven't ever had a cat do anything but lick the outside and go, what do I do with this?
Yeah, so if you just like lick it, it's okay. But if they ingest it, that's inside, you have to induce vomiting right away. Yes.
Wow. Wow. So do they make an Ipecac for dogs?
Yes, they do. They do. We have like many things we can use at home too to make them vomit, like hydrogen peroxide. If your vet is closed, you are like out like in wood somewhere, use peroxide to make them throw up. Use something, but they have to. Yeah.
So now give us a dosage idea. We're talking about 1/4 teaspoon. We're talking about, because hydrogen peroxide is a pretty strong thing that we're doing for cleaning our earrings and our ears and even the floor. So give us a dosage.
So a tablespoonful per 5 pounds to 10 pounds is ideal dose. If your cat is like 10 pounds, a tablespoonful you can give right away, and you can repeat it again in like 20 to 30 minutes if the cat has not thrown up. But usually one will do the trick.
Okay, and that's any kind of grapes?
Any kind of grapes. Red grapes, green grapes, raisins. It's a big no-no.
So since we're on this topic, sadly, pets get poisoned. We leave things in the house. They have access to, and the first thing they do to test it is to lick it.
Lick it and put it in the mouth.
They put it on their feet and they go, oh, well, that's not good.
Yeah.
So give us some idea of household poisons we can prevent. For example, we don't use anything with Lysol. Anything with that chemical base, like cleaning your floors that have Lysol in it or the spray.
Yeah.
What would you do? First give us the chemicals, then what would you do for the poisoning besides get to your vet immediately?
Yeah. So now the number one thing is that all the pets are very curious. It can be cats or dogs. You know, just make sure all the things that can be harmful to the dogs or cats are locked. If you are there, it's supervised, you can keep an eye on it, it's okay. But if you're not home, you're gone, Everything is behind the closet doors, okay? So it's nothing open, it's nothing they are exposed to, you know? So just do that, you know? And also make sure that whatever products you use are pet friendly. So most of the products will say on itself, the label is pet friendly product. So I'll go for organic, pet friendly products, you know, which won't hurt them and it will do the job too.
Okay, great tips. Because one of the things I know I keep finding is I didn't know XYZ poisons them and gets it. Oh, he loves cheese, but he choked on it. You know, and we use a lot of these things when we're dealing with extreme training. A piece of hot dog, not a hot dog.
Yeah.
You know, just a piece, because all
Just a
we're
little
doing is a scent.
piece, yeah.
The scent on your hands to get their attention. A piece of cheese, all that kind of stuff, but not all the cheese.
Not all the cheese.
Not all the cheese.
Just doing like a treat.
Right.
Yeah.
Right. Absolutely. So when we go to adopt, I'm a huge advocate on adopting strays and spay and neuter and that type of stuff. So as soon as you adopt, where, when, any guidelines, you're seeing probably the end of it and the sickness and that kind of stuff. Catch and release, we'll talk about that hopefully a little bit. But can you talk about adoption? Any tips that a vet would say, what to look for before you take on a pet?
So you have to keep in mind what exactly you're looking for in a dog or cat. You know, you want like a small dog, you want a big dog. Shelters or rescue groups have all sorts of dogs, you know, and the best dogs out there are the mutts. Okay.
Good for you.
Mutts are the best dogs
ever. That was perfect.
Mutts are the best dogs, you know. So they have less health issue than a purebred dog, and they make great dogs. So your local shelter should have their website, which have all the pictures, all the information, description of the dogs, and you will find the right match right there. And if you like the dog, you can go and give him a visit in the shelter, and you have to like mingle with him and spend a couple of hours. And if the right match, there you go. You got your dog.
Absolutely.
Yeah.
Now I'm going to go a little deeper because a lot of people won't understand why we're so excited about mixed breeds, and as a pure to a purebred. Purebreds, from my point of view, have been overbred and overdone.
Yes,
my example is I rescued a German Shepherd that was dumped in the yard. He was one, and he didn't know how to walk on a leash. He didn't know how to do anything. But he was bred in Germany and through a German line. So we had not that deep slant the Americans are breeding in now, and this giant 120-pound dog, which should only be a 65 to 85.
85. Yeah. That is 120 pounds.
Yeah,
wow.
We're talking about a whole, and when you have dysplasia already in the breed, you put the slant in. So this is where I talk about, wait a minute, and these mixed breeds are amazing. You get a little bit of this and a little bit of that.
Exactly. Best of both worlds.
Yes. And so is there anything else that we're missing in the reason you say really take a close look at the mixed breeds?
Yeah, you know, so in my experience, the mixed breed dogs have the best of both worlds, like I said, and they have far less health issues. They have far less health problems, you know, because they are like totally belong to different lines. They are not like purebred. There is no mixing of like there is no interbreeding. It's totally different bloodlines. So mixed breed dogs, no health issues, great dogs, you know, great personality, and they live long life.
That's amazing.
Yeah.
I love the blurred lines.
Yes.
The positive of the blurred lines.
Blurred lines.
And that type of stuff. Now, there are times I have professionals that I work with that are doing specific breeds because of therapy issues and the goals with that, or allergy issues.
Yes.
Really got to see somebody test a Bichon Frise who was told that it's allergy resistant, and then visited a family that's highly allergic. And the little girls, 3 and 4, got to hug a puppy for the first time because the puppy was allergy free. And these are the types of things. So just what you're doing is what I talk about a lot with people is this is calming, not only to the cat loves it.
This is calming to us too.
But to us, you have a hard day, you have a bad day, guess what, the cat's there, you give him a hug, it all
It's a therapy cat.
goes
Yeah.
away, and all he wants is food and his
That's
litter
it.
box changed once in a while. Now, some of the maintenance things that, of course, come with a pet that are really great.
Yeah.
And I know at your clinic you can provide
Yes.
nail clipping
Yes.
and groom. And no, I don't think you do grooming, but I'm not sure.
We can bathe the dogs, you know. Some dogs can be a little nervous when they go to the groomers, you know, or they can be a little snappy. So groomers might refuse, you know, we cannot groom your dog, we cannot bathe them, and this can be hard for you too. Just bring it here. What we do, so we just give them a little bit of like chill pills, a little relax, you know. And once they relax, they like to be pampered, you know.
Right.
You can bathe them, trim the nails, clean the ears, you know. You can do everything, you know. So we do bathe the dogs here. But if you're looking for a specific haircut, like a poodle,
Right.
or like you want like a Bichon phrase or something,
Are you
then
doing a Halloween color?
like a Halloween colors, then groomers are your best bet.
Right,
Yeah.
right, and they're trained to
They're trained to do those
that.
cuts, yeah.
And of course, check them out and make sure there's care and love and,
Yep.
and that type of stuff.
Exactly,
Because we've
yeah.
all met that sad end when somebody's had a bad experience, where they come back with a haircut. Not,
Yeah.
I mean, we've all been to hairdressers.
Yeah, it's the same like that. Yeah, I know like
maybe
that.
not. Now I got it 6 weeks till it grows out.
Grows out back,
and that
exactly.
type of stuff. So anything end of life is a really tough subject. I have a lot of work in what I do is having that end of conversation. The worst
Yeah.
decision we all have to make is I have to put you down because your body just won't quit. And my 13-year-old last year, I had to make that decision, and you got to see Tucker and his breathing issues and that kind of stuff, and he was a rescue and that type of stuff. Give us, there's never a finite guideline because the world
Yeah.
changes every day, but
Yeah.
if you had a guideline or 5, could you tell us what are the signs and symptoms, because we love our pets as our
We do.
children,
Yeah.
to make that life and death decision?
Yeah.
When do we come and see you besides all the medical we've seen? I'm going to assume we've all done the medical, we've come,
Yeah.
seen you off and on and said, okay, this is it. The same as I brought Tucker and said,
Yeah.
he can't breathe, but he's just loving life because he's been so neglected.
Neglected, yeah.
So
Yeah.
how do you get him?
You know,
past
that's the hardest part of my job, and it's a very even harder decision to let your loved one go, you know. My criteria for that is, you know, when your pet does not like to do the things he used to do, like
Give us
he-
an example.
yeah, like he wants to, he used to like he fetch a ball, he wants to go grab a ball, play with the ball, he wants to go out on running, you know. He doesn't want to do it no more, you know, and we know he's sick, you know, he's old, he's frail, you
Right.
know, he's no more can stand up, he's like sometimes he just like having accidents, you know, and he's like laying in his own pee, you know, that's not good,
Wow.
you know. That's when you know that this is time, you know, because he's suffering. So other things is, you know, your pet is like going downhill fast, you know, he's lost so much weight, you know, he's like not interested in eating, he sleeps all day, you know. That's when you know that, I mean, he's just giving you some sort of signal, you know, that you have to relieve me, you know, let me go.
Right. Now, there's a lot of pets, I understand, veterinarians that can do home visits
Yes.
and have that
Yes.
with them. I have a
Yeah.
client that did that.
Yes.
And so do you offer any of that? I
Yes.
had never asked.
Yes, exactly. We do actually, you know. Some of the pets really get nervous when they come to the vet, you know, the clinics. I mean, as soon as people tell me all the time, you know, as soon as we park the car in the parking lot, he's just shaking, you know. And I understand that. It's called like white coat syndrome. I know they don't
Wow,
like it
it has
here.
a name.
It has a name. It's called white coat syndrome. They don't like
And it doesn't matter if it's people or
Or the
animals
pets.
because they're all white coats.
It's the same.
and you still don't wear it.
Yeah, we still wear it, but they are so smart.
Wow.
They recognize the place, you know.
And they can smell
They can
it.
smell,
I
they
know
can
that.
sense it,
Yeah.
you know. So some people prefer that we do a home visit for that, and I can do it, yes.
Okay.
I can do it, you know, I can come to your home, you know, I can do it, you know, and afterwards we take care of everything.
Okay.
you know.
Okay. And those are the hard questions
Yeah.
that I want to make sure we cover, because a lot of people are too scared or
Yeah.
ashamed or, you know, how do I make this decision? And that was, I had to make this last year and I was like, really? Even vet psychics, I talked to them for months. Please,
See?
let go.
Let go,
I'm
yeah.
okay. We're okay. And that type of stuff. And then sometimes they hang in there because they're feeling great.
Yeah.
And the first says otherwise because we're just old.
Yeah.
We don't have that last say, but he is so healthy and so well cared for and loved. He gets pet all day long.
And not only that, you know, also it's a very humane thing to do, to relieve somebody of their suffering, you know, when they have no will to live. When we put them down, we just give them a shot, you know, that shot is painless. Takes a couple of seconds, you know, and they just go to sleep, you know, they don't feel anything. It's very humane. Some people think, oh, it's going to be traumatic to him, it's going to be painful, you know. No, it's not going to be. It's going to be very smooth, you know. A couple of seconds, they pass on to heaven. They just go there.
Right,
you know?
right, because
So,
all dogs go to heaven.
yeah,
and
all dogs,
kitties
cats,
and ferrets and
yeah.
rats and mice and that's the one thing I love
Yeah.
working with the rats. They are so intelligent
Yeah,
and
they are.
so amazing.
Yeah.
People don't realize, oh, it's vermin. No,
no, it's
that's our
not.
creation.
Yeah.
But they know things.
They
I've
know
been
things.
lucky enough to study pigs and understanding mirrors.
Uh-huh.
And
Yeah, they
it's
do.
amazing.
They're smart.
They do.
Yeah.
And it's like, you think a dolphin? No, go talk to a pig. They've got this down. So, in concluding, is there any final words that you'd like to encourage pet parents to know or do, just as somebody in the animal world?
I will say, you know, your veterinarian is a part of your family, okay? Have a good relationship with your vet, you know. If you're not sure about something, talk to him or her, you know. Tell them, this is how we feel, this is my concerns, you know. And I'm pretty sure every veterinarian out there wants to help you, you know. So not every veterinarian is money-minded, you know, they want to help you, but it might be that your dog needs more testing, needs more diagnostics, you know. But they are out there to help you. So talk to your veterinarian, just do that. And also believe in preventative care. Get your dogs vaccinated, get them like on good diet, good exercise, make sure get their teeth cleaned every year. So all those stuffs will make sure your pet lives a long, healthy life.
And I'm glad you brought up the teeth. I just want to
Yeah.
elaborate on that. I had a client last week, and the same thing. I'm saying,
Yeah.
please go get the teeth because
Get
the
the teeth.
diseases you
Yeah.
get, and people get this too, but
Yeah.
they don't understand with their dogs. Oh, it's just another spin. I said, yeah, but just the bacteria alone goes systemic through the body.
It's
and
gonna shower your body.
And you've got a
Yeah.
dog that has mystery illnesses, and his joints
and his-
will hurt,
there you go.
and his brain
Uh-huh.
goes, and you'll be surprised just
Just
because you didn't get the teeth
teeth
done.
cleaned, yeah.
And sadly, a young woman whose grandmother didn't have the ability
Yeah.
to bring her in, but she
Yeah.
didn't call for help. The
Help,
granddaughter
yeah.
went to
Mhm.
visit, and we pulled half the teeth when I was in clinic because they had rotted and were literally poisoning him. But you know what? After that was done, I was so happy.
Feeling better.
So happy.
So happy,
No
yeah, see?
pain, no swelling. We
No
got
swelling,
all that
nothing.
down
All
and
that
put
down.
on soft food.
See, there you go.
So there is help. Please ask for
Yeah.
it. And thank you everybody for joining us with Dr. Aborn. Thank you so
Thank you, Aminah,
much
for
for
having
your
me.
time.
Thank you for having me.
Appreciate
I really
it.
appreciate your effort to bring this stuff, you know, because it really helps us and the people and their pets, you know, to get better health, better shape, you know, and just like live a long, healthy life.
And that's what we're trying to do.
That's what
Educate
we're trying to do.
little by little.
Yeah.
Thank you so much.
Thank you, Aminah.